Thank you for joining us. Our program today is on trends in education with Dr. Orien Tulp, President of USAT, the University of Science, Arts and Technology. Along with his esteemed colleagues, Dr. Tulp will update us on the essential work they're all doing in advancing the careers of hundreds of graduate students in their workshops and classrooms. USAT also utilizes instructional technology to efficiently implement distance learning in their collaborative, remarkably successful educational courses offered by their dedicated faculty. With us now is Dr. Orien Tulp, President of USAT, and Professor and Dr. Ramsaran. A pleasure to have you on the program.
Nice.
Good to see you again, sir.
Thank you, Richard.
We're talking about humanitarian projects. Please share with our audience what specifically USAT and you are doing in that area.
Well, we have a number of things that we've been doing and will continue to do that are in the humanitarian medical support area. And one which I haven't really talked with you about very much is we have been doing some in Dominican Republic in some of the needy areas. And we've now sent two missions down to DR to provide assistance to medically underserved areas and populations, and they've been very, very successful. The government has cooperated with us quite nicely on those missions. And I've also done a lot of the similar types of processes, the humanitarian missions in South America, the Altiplano and other areas of South America, where there is essentially no medical assistance at all. We've set up over 40 clinics just in Bolivia.
So essential and most commendable.
Yes.
And you, Doctor, you're doing actually the same thing right here in South Florida.
Yes, we are. Not only South Florida, but different parts of the United States. We have a free clinic where we don't charge the patients, but the services provided to the patients are supported by different grants from different organizations and private donors. And what we do is we provide primary care, internal medicine, pediatrics, geriatrics, and we provide this for the patients who have no health insurance and who also are of low income. So we use the federal poverty income guidelines to determine whose income is low, and based on that we have these patients that are eligible for care. They come into the clinic and we provide the service for them. We also provide medications and medical equipment that they might need, all at no cost to these people. And we do this on a regular basis in North Miami Beach and in Opelika, Florida. And also we have a mobile medical clinic. Mm-hmm. The mobile medical clinic is a full service primary care clinic that is on wheels, and we can take this clinic to the site of any disaster. We provide internal medicine care for the people there. We have equipment that we can do some suturing, and we have EKG machines. We can actually provide the need that the people have on site. This is usually very helpful because when there's a disaster like this, the doctor's offices are probably affected themselves. The hospital is also affected. And so help really needs to come from outside. And we've done this since Hurricane Charlie in 2004, and pretty much every tornado or hurricane that has affected the United States, especially the Gulf area, New Orleans and those areas. We stay at the site of the disaster for anywhere between 1 to 2 weeks, as long as the need exists, and when we've provided the care, we leave. We have people on the ground such as the health department that would assist us to follow up on some of these people. And when we do run out of supplies, because the vehicle can only take so many supplies, we have supplies being brought to us frequently by the health department, immunizations in particular from the health department, and other medical supplies from the, brought in by the military. And we do also partner with the Red Cross, who would provide other healthcare professionals.
And speaking of partnership, you're also a professor at USAT. Tell us about that.
Yes, and this clinic is one of the sites where the students at USAT and other universities can come and get hands-on clinical experience there.
How is your mobile medical service funded?
We are funded from grants, from donations, also from private donors. Anyone wanting to support this work can go to our website, which is mercymobile.org, www.mercymobile.org, and there's a place on there that you can make a donation using credit card, or you can call us and so on.
Dr. Tulp,
Yes.
what are your thoughts with regard to mobile medical services?
I think they're absolutely essential, and they provide a valuable link, a critical link, in terms of a disaster or a humanitarian need in places where they're essentially, in a sense, it's similar to what we saw when we worked in areas of South America where there were no medical clinics. And that's essentially what you see following a national disaster. There are no functioning medical clinics after the disaster. So it's absolutely essential for mobile clinics such as this to be able to move in, set up shop, and be able to deliver the medical services to those who are the most critical at that time. You see all kinds of abrasions and injuries of every imaginable type, everything from debris, flying debris, lacerations, fractures. Almost everything that you see in any ER is likely to walk through the door.
Dr. Tulp touched on a very important thing there, because people who are uninsured do not have health care available to them on a regular basis. So that sometimes when they come to where they can finally get some health care, they're very sick. And so the pathology is at the stage that's very useful for students, not so good for the patient, but very useful for students who would not see this degree of pathology in a place where you only see insured people who maybe don't get to that stage that frequently.
No, that's absolutely correct. The ones that come in do not have minor illnesses. They're not there because of some minor, irritation or something. They're really ill when they come in. They really need medical care, and they usually needed it yesterday. So they're very advanced in a critical state when they come in, especially in a disaster area. But even anywhere in the, one of the patients that came into one of our clinics had been bitten by a snake, a poisonous snake in South America. And it took him 7 days to get to the clinic, at which point he was pretty far along. The infection was serious, and ultimately we had to amputate his leg because of that.
USAT stays in the forefront of technology, trying to keep abreast of trends and so forth, and is very successful in doing so. Since you're not overly large but growing rapidly, tell us of your tendency with USAT to be cutting edge.
We look for the latest in educational technology. We revisit the curriculum on a regular basis, not just once a year like most universities and institutions do. We revisit it each time we give a lecture. We update the lectures on a daily basis practically, based on new information that's coming available, new publications. Some of our professors, on one day they may give you a slide set for their slides, and the next day they'll say, oh, we have to update that one because I've added 20 more slides last night based on the latest report from a particular journal that they might have been reading. And we try to stay ahead of the ballpark on those to make sure that what we're teaching the students and the presentation that we have is going to be the best and the most current information.
Dr. Tulp, we make a lot of use of the fact that students can actually work in their healthcare professions at the same time while they're at USAT.
Absolutely.
So these people, when they do get to the clinicals and later on, they get into the good residency programs, and they're skilled because they really have been working as healthcare professionals, either physician assistants or nurse practitioners or RNs like myself. You know, back in my day when I was just getting into med school from the being an RN, we didn't have this.
No.
But I could still remember one of my reasons for excelling the way I did in medical school was the fact that I had all of this experience when I went in as a brand new medical student. And here you've made the program work so that people are given the benefit of already having this experience and still going along, keeping the job, so that the financial burden is relieved from the student as they can work while going through school. So this is an excellent thing.
It's an excellent bridge program, and the bridge only has to be as long as the gap between where they are and where they need to be.
Yes.
What you're both doing is so extremely important and most commendable. A pleasure having you back on the program,
Thank
sir.
you so much, sir.
Thank you.
It's a pleasure.